So I'm going to be testing the cranial nerves while I'm doing this. I know that she's a neuro patient, so I'm going to be locking my knees with hers just to keep her protected. To start off, I'm going to test cranial nerve 1, which is the olfactory nerve. Any abnormalities of this nerve would be unable to smell or unable to distinguish smells. So Heather, go ahead, close your eyes, cover one nostril, and tell me what you smell.
Coffee.
Good. Cover that other nostril and keep those eyes closed. Tell me what you smell.
Peppermint.
Good. So now I'd like for you to stand up and turn to your right. Good. So I want you to look at that smell and eye chart right there. Go ahead, cover one eye. Can you read line 8 for me?
DEFFOTEC.
Good. All right, cover that other eye for me. Can you read it backwards?
CETOPFED.
Good. Let's go ahead and have a seat. Any abnormalities for cranial nerve 2 would be unable to read the smell and eye chart, and not having 20/20 would be unable to read above line 8. So for the other part of cranial nerve 2, I'm going to be testing her peripheral field vision. So Heather, tell me when you can see both fingers.
No.
Good. How many fingers am I holding up in this hand?
3.
Good. What about this hand?
3.
Good. So any abnormalities of that cranial nerve would be unable to see within the peripheral field vision. So now we're going to go into our next cranial nerves, and that's where we're going to group 3, 4, and 6 together. So the first one, what we're going to do is trochlear. So right here, follow my finger. Good. Once more. Good. So that's for trochlear nerve, cranial nerve number 4. And any abnormalities of that would be unable to follow my finger down and in. And for that cranial nerve specifically, I'm testing the superior oblique muscle. All right, so go ahead and follow my finger once more. So as you can see, I'm doing an H tracking field with Heather. I'm gonna do an H twice, one to watch the right eye, and the second time to watch the left eye. And so that's the test for cranial nerve, all 3 of them, 3, 4, and 6. And I'm looking for nystagmus or strabismus. And I'd be testing the lateral rectus muscle for cranial nerve 6. And then for oculomotor, I'd be testing all the other eye muscles. So now I'm gonna test right here her oculomotor. So Heather, I want you to look from side to side of my fingers. And one more. Good. So for that one, I'm looking for a smooth pursuit as she looks from one finger to the other. And any abnormality of that would be a saccade. All right, so go ahead, cover one eye for me. Good. Bring it down. Cover the other eye. Good. Bring it down. So for that one, I'm looking for dilation of the pupils. All right, so now I'm going to shine the light in her eye, and I'm going to be looking for pupil constriction. Now for these, the abnormalities here would be the eye is unable to dilate or constrict. So I'm right here, I'm shining the light in her eye, and I see that pupil constrict. And I see the pupil constrict in the other eye. All right, so now we're going to move on to facial sensations, and we're going to start that off with testing for cranial nerve 5, which is our trigeminal nerve. So to start off with that, I have a safety pin here, and I'm going to wipe it down with the alcohol pad here. I'm going to take the safety pin to the patient's face, and I'm going to have them identify if it's a sharp or a dull feel. So let me see your hand. This is what it's going to feel like on one end, feel like on the other end. Is that okay?
Mm-hmm.
All right, so go ahead, close your eyes for me. Tell me what it is that you feel.
Dull. Dull. Sharp. Sharp. sharp, sharp, dull, 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 sharp, sharp.
Good. So the different regions that I'm taking the safety pin to is in the ophthalmic region, the maxillary region, and then the mandibular region. And then I'm gonna take 2 cotton balls here. This is gonna be for soft touch, and I'm gonna have the patient tell me if they can feel and have them answer with yes. So close those eyes for me.
Yes, yes, yes.
Good. So any abnormalities of the sensation aspect of trigeminal nerve would just be unable to sense any of the feel that we just did. So for the motor aspect of trigeminal nerve, I'm gonna have you clench your jaws. I'm gonna take my hands to your face. Is that okay?
Mm-hmm.
Okay, go ahead, clench those jaws. Good. Now I'm gonna pull down on your chin. Don't let me move you. Good. Open up that chin. Don't let me push you up. Good. And to complete the trigeminal nerve, I'm going to do a jaw jerk reflex. So I'm going to take this hammer right there. Is that okay?
Mm-hmm.
All right, so barely open your mouth. Good. So now to go on to facial nerve, that'd be cranial nerve 7. I'm going to have the patient stick out their tongue and tell me what it is they taste. So Heather, go ahead, close your eyes. Stick out that tongue. Tell me what you taste.
Sugar.
Good. And I'm gonna have them do it once more.
Salt.
Yeah, salt, right? All right, so for the motor aspects of cranial nerve 7, I'm gonna have them perform some actions of their face. So go ahead, smile for me. Good, frown. Raise those eyebrows. Good, puff out your cheeks. Good. And, oh, close your eyes tight for me. Don't let me move you. Good. So any abnormalities here would be just unable to perform those exercises. And any asymmetrical actions when looking at the face.
Okay.
So now we're going to be testing cranial nerve 8, which is the vestibulocochlear nerve. I'm going to put my hands around the patient's head. Is that okay?
Mm-hmm.
Okay, so I'm going to turn quickly to the side. Good. And I'm going to come back up and quickly turn to the other side. And I'm going to be observing signs of nauseousness and dizziness, and I'll have my trash by my table if I need it. All right, Miss Heather, so now I'm going to help you come up. So go ahead, come up for me. Good. So now I'm going to perform the Dick-Hall-Pipe test, and for this one, I'm going to stabilize the patient's head, and I'm going to quickly take them down to the table, so firmly hold on to my arms. Good. And take it down. Good. And I'm going to help you come back up. So I'd be looking in their eyes for about 30 seconds, just observing for any signs of nystagmus. Okay, so now I want you, let's give it a second, I'm a little tall. So what I'm gonna want you to do is swing your legs out to the side facing Jenny. Yeah, so we can see what's taking place. We're almost there. So go ahead and hold your thumb out for me. So on my beat, I'm gonna have you turn your head towards your thumb each time. So it'll be like this right here. All right, and good. All right, go ahead and relax. So now hold your hands out like this. Close those eyes. Go up, touch your nose with one hand. Good, now do it with the other. And once more on each side. And again. Good. So I'm just looking to see if they're touching their nose, if they're touching their forehead, if they're not going in a linear motion, just signs like that. All right, so now Heather, I have a vibration tuning fork here. So I'm gonna hold it right here on the top of your head. Can you feel that in all directions?
Yes.
Okay, does it feel equal?
Yeah.
Okay, good. So now, tell me, can you hear it?
Yes.
Can you hear it?
No.
Can you hear it?
Yes.
Good. Can you hear it?
No.
Okay. So now we're going to do the finger wrestle test. So tell me which side you hear the wrestling on. Good. And once more. And one more time. Good. So for these next few ones, we're going to test cranial nerve 10 and 12 together. It's going to be the vagus nerve and the hypoglossal nerve. So I'm going to ask the patient to swallow. And I'm going to be palpating, just seeing if it's a smooth swallow or if it gets interrupted in any type of way. So now will you go ahead and stick your tongue out for me? Good. Say ah.
Ah.
Good. Now take your tongue from side to side a few times. Good. So during this, I'm observing for any gargle speech. I'm observing for tongue, uvula, and palate deviation. If there were to be a tongue deviation, for an upper motor neuron lesion, it would go opposite, and for a lower motor neuron, it would go ipsilateral. And then for the uvula, if it were an upper motor neuron lesion, it would be ipsilateral, and then a lower motor neuron lesion would be contralateral. So now to finish up for cranial nerve 11, that'll be the spinal accessory nerve. I'm gonna have you elevate your shoulders. Good. I'm gonna apply some resistance. Don't let me move you. Good. So now I want you to turn towards me. Good. And don't let me move you. Good. So for this, I'm just testing the sternocleidomastoid muscle. Go ahead and bring it the other way. Good. And on this one, I'm just looking for any abnormalities of muscle strength.